Do Arab immigrants in the US have feasible reproductive health education? Hi, I'm Al-Jumaa, the lead researcher of feasibility of pre-recorded reproductive health presentations for Arab Americans, refugees, and immigrants. The life of a non-English speaker in the US is not as easy as one might think. People from all over the world immigrate to this country for better opportunities and improved access to education, career, and most importantly, health access. But what if those opportunities and access to health education were forced shut due to language barriers and/or being unfamiliar with the US healthcare system? Arabic, a language spoken by millions around the world, is not nearly as prevalent in the US, resulting in a lack of importance on providing resources in this language. One very important subject with a lack of Arabic resources in the US is pregnancy and postpartum care. Pregnancy as an Arabic-speaking immigrant in this country can be burdensome for a few reasons. The first reason being, sexual reproductive health is not discussed enough in the Middle Eastern refugee and immigrants communities in the US. The other reason is lack of knowledge on postpartum care in addition to language barriers and being unfamiliar with the US healthcare system may impact women's health after delivery. A lack of knowledge on how to access proper healthcare or simply the proper resources to tackle such a journey could lead to potential health dangers and causes worries for not only the mother but also her family and loved ones. Pregnancy and postpartum with no proper care can lead to death. It's already difficult to find the appropriate health care as native English speaker. So imagine the struggle of having that language barrier and being unfamiliar with the US health system to find the most suitable health resources. Our project aims to address this issue by revealing the most feasible methods to educate Arab immigrants and refugees from different ages and social status, men and women alike, about postpartum care, whether children are of the question or not. We did an assessment on whether pre-recorded postpartum care presentations can be used to increase postpartum health literacy. Postpartum educational sessions with the presentation of pre-recorded videos were created for the Arab immigrant community. One of the most important factors is that we are using culturally acceptable methods. We aim to analyze the effectiveness of this method by measuring improvements in knowledge toward postpartum care. Our study is approved by the Institutional Review Board. We used a pre- and post-survey methodology. We got a convenient sample of 51 Arab refugees and immigrants in California. 47 of those participants completed both their pre- and post-surveys. We did 4 in-person and over Zoom sessions in Arabic and English between December 22 and March 23. We presented our pre-recorded videos during those sessions. We distributed a 33-question pre-survey and a 2 to 4 weeks after the session follow-up survey via phone. Our surveys were done on a 5-point Likert scale. These surveys assess demographics, e-health literacy, reproductive health literacy, maternal health, postpartum care, and mental health literacy. We did a descriptive and bivariate analysis and regression analysis using a statistical analysis system known as SAS or SAS. Our proposed solution to this dilemma we have described is intended toward the adult Arab immigrants and refugees community of Orange County, California, men and women alike. Most participants are Iraqis and Syrians. The rest are from other Arab countries. Most are under the age of 35, most are females, have college education or with a college degree, most identify as Middle Eastern North African, most are single and with no live births. Most prefer to speak in Arabic, however most can read and write in English. In our results, we saw significant improvement in both e-health literacy and reproductive health literacy. Those under the age of 35 improved in reproductive health literacy more than those over the age of 35. While controlling for age group, women who had 0 live births have greater increase in reproductive health literacy by almost 1 point higher. Our pre-recorded presentations on postpartum care increase the knowledge in e-health literacy and reproductive health literacy in the Middle Eastern immigrant and refugee community, which can fill in the gaps in self-reported knowledge and literacy on postpartum care. Even women who have not had live birth yet were interested and learned from the information about postpartum care we presented in our sessions. Just as this method has worked in previous literature, it worked in our settings as expected. This means this method could be used for other health topics and/or other immigrant communities. Women were interested in learning and including their partners in these sessions. Further research can be done on already existing groups in the community as it would be easier to spread this awareness. Using ReproNet YouTube channel and its website, which is made specifically for refugees and immigrants to provide the appropriate reproductive health resources in different languages beside English, such as Arabic, Pashto, and Dari. The resources we provide are culturally acceptable, feasible, and reliable. They're also accessible and available to everyone. This will help new immigrants, and instead of them being lost and afraid to start a new family after coming to the US, they are confident and ready to begin this new journey of life. Postpartum care shouldn't be something with limited access. Rather, it should be available to everyone in a way that makes their journey easier and makes it easier to start a new life and a new family in the United States. I would like to thank everyone who made this research possible. And of course, special thanks goes to Dr. Teal, my mentor and principal investigator in research for the last 2 years. I would like to thank my research team, Ghina Sabbagh, Noor Abu Shaban, Hussein Aryan, and Heidi Al-Sharif. I would like to thank those who are behind the scenes. Dennis Holt, the statistician who helped us in doing our data analysis. Big thanks to Asya Yama, our research coordinator. Thanks to Mr. Muhammad Habibullah, our Red Cap trainer. I would also like to thank and acknowledge the efforts of Dr. Heidi Nerma and Dr. Dalia Al-Haidari in helping us with accurate medical terms, translation, and advice. Lastly, I would like to acknowledge and thank the Undergraduate Research Opportunity Program at UC Irvine on accepting our proposal and providing the funds needed for this project.